So let me just plunge in. I like to start with something totally obvious, which is healthcare is moving into the home. I like to do like a quick poll of how many people are wearing a healthcare device right now. This is a clinically oriented crew, so that's kind of a giveaway. I've had people talk about pacemakers and other things, but of course I'm alluding to all devices which Best Buy sells, Aura rings, Samsung rings, Fitbits, Apple Watches, etc. So yeah, and a lot of people view those as consumer devices, but of course all those companies, Google, Apple, Samsung, would love you to view them as clinical devices. And of course, from a Best Buy perspective, that interests us a fair bit as well. But I'm actually not, as a practicing physician, so much interested in the consumer side of healthcare, despite working for Best Buy. In fact, we're working at this care at home problem, which is less about consumerism in healthcare and more about the clinical part of it. And of course, what's the problem statement? Our aging population. We don't have enough hospital beds, ER beds. We don't have enough primary care appointments. And we have a population that prefers care at home. The technology, as we've talked about, this is tracking my AFib as we speak. The shortage of healthcare workers to actually see people in those clinical settings. And then finally, the fact that there is reimbursement for this today, not maybe at the PPO level that was mentioned before, and certainly a little bit at risk with the current budget reconciliation process. So maybe until September, there's reimbursement for this, but at least for now. And so Best Buy as a company is interested in it, and I'm going to explain kind of why. So unfortunately, I think my marketing person lowered our 44 billion from like 47, 48 billion based on, again, it's a little tough to be a public retail company right now in the setting of tariffs. I know they're probably affecting your business as well. But again, if you manufacture or resell a lot of things from China, this slide can change pretty actively. But the next three parts of it are to indicate of our scope and scale. We're in every state. Geek Squad, which a lot of you know of, is 20,000 employees in a highly rated, highly profitable part of Best Buy. And of course, that means we are proximate to everyone and everywhere. And this means that we have a relationship with the consumer. And of course, from the consumer perspective, they are interested in technology. But I do want to refocus us again on what that means from a Best Buy perspective and shifting into the clinical side of it. So how many knew of Best Buy's presence in healthcare outside of consumer, outside of buying, again, Apple Watch there? A couple of people over there. I'm a little blinded, but thank you for raising your hands. So we have a company that's part of Best Buy called Current Health. That's the 69,000 number that does high acuity. So that's enabling hospital at home programs and generally CAR T and things in oncology that where you want to drive care to the home. Again, we have this active Geek Squad that people may hire to put in their TVs, but can equally do RPM and other care devices in the home. I've mentioned some of these other consumer parts, but we're also the largest seller of a fall detection device, one called Lively, which means that we have a 1,000-person call center that's not just responding to urgent care and falls, but also doing social care. So we have a partnership with Lyft, several grocery retailers for food delivery and transportation. I keep getting closer and closer to the clinical side, and now I'm going to cross over to it. So what does it mean from a Best Buy perspective? Really to focus on everyone, whether it's directly as a consumer, but also shifting into the patient. But importantly, this is where I can't remember if this is being recorded, so I have to be careful what I say. Unlike some of our retail competitors, we view our role in healthcare as a trusted brand, but not as a clinical role. In other words, I'm the chief clinical officer of a non-clinical company. We only partner to do healthcare with health systems, with health plans, with pharmaceutical companies, and not directly do care ourselves. So again, enabling this continuum of care. These are our 3 areas of focus. I talked a little bit about the high acuity piece, but of course, chronic disease management, classic RPM, and then finally, transitional care, thinking about the post-acute space. This is our active customer base. Around the country, again, using, in many cases, Geek Squad to deliver this technology at home. Again, that's a lower licensure than most health systems would necessarily have available to them to deliver technology. So again, a lot cheaper than having an MA or nurse do it, have Geek Squad do it. And then doing different levels of acuity in different places, including some health systems very close to where we are right now. I'm now going to go into a couple of examples to close out. So I mentioned Lively. These are the what we would used to say a phone system. So many of you have heard of the Jitterbug phone. That's actually a Best Buy company. And again, enabling aged seniors either directly through consumers. We have roughly 400,000 to 500,000 of these that are being actively used across the country today, but also being used in senior living facilities, being used by health plans as a supplemental benefit to, again, to reduce falls and increase the social cohesion in the home with external support through technology. Elevance, a company, depending on your perspective, you may be excited by because of their reimbursement or less so. But again, they're an example of using our fall detection, but also in cases using Geek Squad to install technology in the home to support this healthcare paradigm. Geisinger, this is an example of a Geek Squad. So they have rural northeastern Pennsylvania. They actually have a very disparate patient base. So they actually use Geek Squad to go into their sickest patients' homes and deliver the technology so that they don't have to come in and use the limited primary care appointments. And then finally, Mass General Brigham, which uses us for their high acuity care. They're one of the largest hospital at home programs in the country. Again, this is important from a silver tsunami. I actually think the next speaker is going to talk a little about this. But what's happening in Massachusetts, where Mass General Brigham is the largest health system now, they can't build any new physical hospitals. So their goal is to have a 500-person, 500-bed virtual hospital, which we support. So again, this is very possible. This is being done. And I'm obviously excited to talk about it. I left time for questions in case there are any questions, but obviously I can, I'll be here afterwards if anybody wants to talk to me about health and home.
Well, seeing none, thank you so much, man. Let's give it up for Den Zaniello.